Nicola Hill. She joins us now from London. Nicola, tell us more about this latest information from Remdesivir.
Yeah, so the WHO is constantly monitoring all the trials that are underway with various treatments to try and help patients with COVID-19. And as you just said then, they've looked at 4 trials involving 7,000 patients and have concluded that it actually doesn't add any benefit. It doesn't stop people from going onto a ventilator. It doesn't improve the symptoms. And importantly, it doesn't make people live longer. It doesn't stop them dying of the disease. So that's why they've now said that as it's got of no benefit and it might possibly even do some harm, but they haven't given any more details about that, they're no longer recommending that it should be in any doctor's arsenal, which is fairly limited, for treating COVID-19. Now, it is interesting, isn't it? Because, of course, President Trump, he took it. It was part of the array of medications that were effectively, they threw everything, including the kitchen sink, at him. And he publicly said it was so wonderful that he was buying up the world's stocks that he could give to Americans. But we don't know what it was exactly that helped him. And we don't know how, the fact he was treated very quickly. And we know that's one of the things before people become very severely infected with COVID-19 is a benefit. So we've got no idea what was the best thing that helped him. But with Remdesivir, it obviously was thought to be something that was going to be helpful, but it effectively isn't. Now, there's been a lot of reaction to this. Obviously, Gilead is saying one thing, but a lot of the doctors had already said that they hadn't been seeing very much benefit. And I mean, it's an expensive drug. And when we first heard about it, that was one of the things that was highlighted. It's more than $2,000 for a course. And it means that a patient has to be given it intravenously between 5 and 10 day period. So if you've got a hospital with a lot of COVID-19 patients, you've got a limited budget, it would completely cripple their finances. And it also meant doctors would have to decide who gets it.
Yeah.
Now, the trials of the drug will continue, and the WHO has said it supports those, but these will be trials in perhaps people with more moderate COVID-19.
Very expensive, especially if you consider the fact that most EU countries will be buying Pfizer's vaccine with BioNTech for about 15, 16 euro. At least those are the numbers that I saw. All right. You said that the WHO doesn't recommend Remdesivir to be in any arsenal. Let's talk about this arsenal. What other options of treatment are there?
Well, it's limited, isn't it? I mean, the main one that we all know about is dexamethasone, which is the steroid, and that's also cheap as chips, and it was one that most hospitals already had in their pharmacy. So it was, great when they found out that that was one that actually did work. There are lots of trials underway. So the WHO has something called the Solidarity Trial, which is where these results came from. Here in the UK, we've got the Recovery Trial, where they're looking at a whole variety of drugs that are being investigated. There's some good news today of another drug called tocilizumab. It's an anti-arthritis drug, and it's a small study, and it's what's called a preprint. So this study hasn't been peer-reviewed at the moment, but it's being done by Imperial College here in London and Utrecht University, and that's shown a marginal benefit to the critically ill people with COVID-19. Now, I have to say that again, you've got doctors who are commenting on this saying it could be good, but it's a small study, we don't know. And of course, the thing with Remdesivir, initially there were a couple of studies showing it was of benefit, which is why it was used so widely. So we genuinely don't know whether this tocilizumab, this anti-arthritis drug, is going to work, but it's an immune modifier. In other words, it's another one that helps dampen down the immune system when it goes into overdrive. So we'll have to wait and see about that one.
Okay.
Lots of other drugs are being investigated in small trials across the world, and when we hear some good news about one of those, obviously we'll be talking about it. But a lot of the concentration was on the vaccine. Don't forget, there's still the same science collaboration on potential treatments. It's just they haven't seemed to have found anything yet.
All right, our health correspondent, Nicola Hill, live for us from London. Thank you for that.